Hello, informed humans, and welcome back to the show where we take complicated medical concepts and translate them into plain language that actually changes how you make decisions. You are listening to the AI avatar of Dr. Irina Lazuk, dermatologist, skin scientist, and the woman who has been correcting this particular misconception in consultation rooms for years and is genuinely delighted that the medical literature has finally caught up loudly enough for everyone to hear. Dr. Lazuk is not with us today because she is currently suspended from a glass observation deck on the 72nd floor of a research tower in Dubai, having accepted an invitation to speak at an international regenerative medicine symposium that apparently takes place at a significant altitude for reasons nobody has adequately explained. She delivered her keynote this morning. It was reportedly excellent. She is now refusing to come down because the view is, in her words, clarifying. The symposium organizers have sent up coffee. The coffee has not helped. We are monitoring the situation from a comfortable distance. So, you have the avatar, and today we need to correct something. A widespread, persistent, genuinely consequential misunderstanding that affects how people make treatment decisions, what they expect from those decisions, and whether they end up satisfied or confused and disappointed. Today we are talking about Sculptra, and specifically about why calling it a filler is wrong, not slightly imprecise, not a harmless simplification, actually wrong in a way that leads to real problems. Let us start with what a filler actually is. Because the word filler means something specific, it is worth being clear about it. Traditional dermal fillers, the hyaluronic acid kind, the ones most people are thinking of when they hear the word filler, work mechanically. The product is injected, it physically occupies space beneath the skin, volume and contour change are visible essentially immediately, and over time, as the material is gradually metabolized by the body, the effect fades. Simple input, immediate output, gradual fade. That is a filler. It is a mechanical solution. It corrects contours and replaces lost volume directly and effectively. It does not meaningfully change how tissue behaves. It does not change how tissue regenerates. It fills space. Sculptra does something categorically, fundamentally, biologically different. When Sculptra, which is made of poly-L-lactic acid or PLLA, is injected, the product itself does not fill anything. Once the initial swelling from the injection resolves, the material is largely invisible. And here is where people who are expecting filler behavior start to panic. Because nothing seems to have happened. But something is happening. It is just happening on a biological timeline instead of an immediate one. The PLLA particles act as a signal, specifically a signal to fibroblasts, the cells in your skin responsible for producing collagen. They see the PLLA particles, interpret them as something that needs to be addressed, and begin generating new collagen to encapsulate and respond to the material. And the visible improvement that develops over the following weeks and months is not the product persisting in your tissue. It is new collagen, your collagen, generated by your own biology in response to the signal. Read that again. What you see improving is not the material that was injected. It is structural tissue that your body built. That is not a filler. That is a biostimulator. And those are not interchangeable words for the same thing. They describe completely different mechanisms with completely different timelines and completely different expectations and completely different ways of going wrong. Here is why the language matters so much practically. When people think they are getting a filler and they are actually getting a biostimulator, they show up for their follow-up appointment 2 weeks later expecting to see results. They do not see dramatic results yet because collagen regeneration takes weeks to months to become fully visible. So they conclude it did not work, or they pressure their provider to do more sooner. Or they feel disappointed and anxious during exactly the phase when the treatment is working correctly and needs to be left alone. And when providers describe Sculptra as a filler, they may be tempted to treat it like one. Rushing sessions, over-treating to create immediate visible correction, ignoring the spacing and dilution protocols that exist specifically Because this is a biological process, not a mechanical one. Biostimulation is powerful. It is also not forgiving of shortcuts. It rewards precision, patience, and proper preparation. It punishes the approach that works fine with fillers. Inject more, correct more, see results immediately. Recent clinical studies published in early 2026 have made this distinction impossible to ignore at the medical level. Research is now evaluating PLLA not just for facial volume, but for broader tissue laxity and structural support, areas where nobody would consider using a traditional filler because the goal is not volume replacement, it is tissue quality improvement. These studies measure outcomes in terms of elasticity and collagen development over time. They emphasize ultrasound guidance and injection depth and post-treatment management in ways that reflect a fundamentally different understanding of what this treatment is doing. The researchers are not treating PLLA as a cosmetic filler. They are treating it as a structural regenerative signal capable of modifying tissue behavior over time, which is exactly what it is. So what should you actually know if you are considering Sculptra or have already had it? Results are delayed. This is not a problem. This is how it works. If you are evaluating it at 2 weeks, you are evaluating it too early. The full picture of what your body has built takes months to see. Outcomes vary based on tissue health and inflammation. A system that is already inflamed or compromised does not regenerate as cleanly or predictably as a system that is calm and prepared. This is why everything we have discussed in this series about reducing inflammation and supporting barrier integrity before interventions matters just as much here as anywhere else. Technique is everything: dilution, depth, placement, spacing between sessions, post-treatment massage. These are not minor technicalities. They are the difference between a beautiful, gradual improvement and a nodule forming under the surface. This is a treatment where provider expertise is not optional. And most importantly, if you go in expecting a filler and you get a biostimulator, you will spend the entire process confused and dissatisfied, even when everything is working exactly as it should. Calibrated expectations are not a soft outcome, they are a clinical outcome. They determine whether you protect the process or interrupt it. Sculptra is not a filler. It has never been a filler. It is a collagen biostimulator, a regenerative signal, a treatment that works by improving the conditions under which your own tissue rebuilds itself rather than by placing material to create an immediate correction. And in 2026, with the science now clearly and publicly saying exactly that, there is no good reason to keep describing it otherwise. Before we close, everything you just heard is purely for entertainment and educational purposes only and does not constitute medical advice, treatment recommendations, or guidance specific to your individual situation. Sculptra and all biostimulatory treatments should be discussed with a licensed medical professional who can evaluate your tissue health, your goals, and whether this approach is appropriate for you. Please consult a qualified dermatologist or aesthetic physician before making any treatment decisions. Dr. Lazuk will be available for consultations as soon as someone convinces her to step back from the edge of that observation deck. Updates to follow. May your skin always glow as brightly as your smile.